So, good morning, everyone. And today is a different day. And we all are in this together. We got to work together, and we'll get through this together. And the best part about being the county executive of Rensselaer County, or I was going to say Rensselaer County, yeah. I have Rensselaer County executive with me, Steve McLaughlin, is working together in a partnership in the Capital District. And that's what today's about, talking about the numbers and what direction we're going into. So I'm just going to give our brief numbers, and then I'm going to hand it off to my counterparts, and then we'll talk a little bit more. But again, as we all know, today's 268 days for us here in Albany County. March 12th started the first date, 39 weeks later. So, we have, as of today, 6,501 positive cases of COVID-19, 2,191 people that are currently mandatory quarantine, and today's positive rate is 177. So, which is down a little bit from yesterday, but it is the second highest to date that we've had since the beginning of this. Out of 19 that had close contact of the cases, 14 were healthcare workers or residents of a healthcare setting, and 3 reported traveling out of state, and 141 people didn't have a clear source of infection. So again, it's something that we continue to talk about people being honest and telling us where they're at and where they're traveling and who they were exposed to or got exposed by somebody else. As of today, 25,000 people, 412, have now completed quarantine. 5,395 have completed quarantine. 5,395 tested positive for the virus, and we have 54 recoveries as of today. There are currently 89 people in the hospital. Yesterday was a record high at 96, but we still had a hospitalization rate of 16 new people going into the hospital. So again, we're seeing more people going to the hospital, but the same number of people coming out, but again, it's still record high numbers. We're having hospitalization. ICU beds, like I said yesterday, at 16 was the highest it matched in April, but the ICU beds dropped down to 14. So we have 14 people currently in the ICU, which is good that number is going down. Our hospitalization rate is at 1.3% of those that have tested positive. Yesterday, the rate was 1.51. And again, over the last 5-day average, we've had 165 new positives each day. Yesterday it was 150. So as you can continue to see that we're still getting more positives, but again, looking at our rolling average of the last 7 days, it's been at 4.8% using the data from December 1st, and the latest available on the state dashboard. So we have to continue to look at that. We had the meeting yesterday with the control room, and that was one of the things when we started talking, and we always talk offline. I've said this since the beginning. I've had a good relationship with Steve and Rory, and we're in this together. And what happens here in Albany County happens in Schenectady and Rensselaer and throughout the whole Capital District. So again, leaning on one another and trying to get through this and figure out which way we can work in a partnership, and I say this, in a partnership with all of us to move forward is the way it gets done. So in the control room yesterday, we were waiting for the guidance. They're still working on that, so we're hoping to get that soon, next week. So, again, they continue to change because this virus has morphed or changed the way it affected us 9 months ago and the way it's affecting us now, and with the vaccine coming out. So there's a variety of things going on that we will get into. But for right now, I'm going to let Steve McLaughlin talk, our Rensselaer County executive from across the river, and let us know what's going on over in Rensselaer. Steve.
Thanks, Dan. Thanks. Good to be here with you and Rory and everybody. And so, Dan went over the numbers there for Albany County. Ours track similarly, a little smaller county, of course, but percentage-wise, probably about the same. Right now, we're at 2,087 confirmed. That is since March, right? So I think it's important to put all this in perspective, as Dan did. 2,087 confirmed cases since March. Most of those have resolved, but currently, right now, 447 active cases. That's by far our largest number since this began. Our first positive was March 17th. And currently in the hospital for us, 17, which is good. We keep a very close eye, all of us do, on these hospitalization numbers. And in quarantine right now, 1,140 folks. So it's important, as we all know, it's the capital region, and this is a case where it's definitely a region impact, because I can tell you just a quick example. We had a case the other day. It affected all 3 of us, And it probably took us 2-3 days by the time we figured that out after talking to the person, because the person was working in Schenectady, lived in Rensselaer County, but some of the folks that were also that contact with that person were Albany. So that's all 3 counties out of 1 case. So, there's a lot of back and forth across the river. Somebody could pick it up here in Albany County, bring it across to Rensselaer County, or just the opposite. They could pick it up in Rensselaer County and come to work here in Albany County or Schenectady County. There's a lot of interplay, as you all know, between these counties. So I think really it's good for the 3 of us to be here together to just kind of get that message out. We're definitely going into an increased case load. We've seen that as the weather turned colder. It's not unexpected that we saw cases going up. But I think just the message out there as we get into the holiday season, to just ask folks to just do their best. Do your best to keep the social distancing, keep the mask wearing when you're out in public and you can't maintain that social distance. That is a good thing and it's important to do. And as a lot of folks did over Thanksgiving, cut back on those social gatherings. Help is on the way. I think that's maybe the biggest message we can send today. Help is on the way, but it's a massive undertaking when they roll out the vaccine to the different phases of who's going to get it and when and how that's going to take place. That's a big logistical undertaking. So it's going to take a little while, even after you hear vaccines are rolling out in December. It's not going to happen overnight. And I think in this day and age, everybody expects things instantaneously that 300 million people are going to get vaccinated overnight. It's going to take a while. So that's why we would just say, I think the vigilance and the importance of just hanging in there a little longer and working together as we are will serve everybody in the region really well as we try to get these numbers back under control. And for all of us, it's hospitalizations and deaths. Cases matter, of course. They're very important to all of us. But we've got to make sure our hospitals do not get overrun, and so that the folks at Albany Med and Samaritan and Schenectady and Ellis, everybody can do their job to get the folks in and out of the hospital that do have to go to the hospital.
You're right, Steve. And again, one of the things General Murphy was saying was important point to put out in the capital region. The region has already exceeded its peak in the spring for hospitalization. So I just want to put in a little point of view. There was 205 people in the hospital, roughly 217, however, in the spring. 100 of the 205 people in the hospital were in the ICU. The region's ICU numbers have been relatively flat, around 30 to 33. So that's the number they've been really looking at. The governor's team's been looking at is the hospitalizations, the ICUs, ventilators, and them numbers have been really good. So though we're seeing an uptick in our numbers and we're seeing that kind of really morph into bigger numbers and more people going to hospital, but we're seeing the hospitalization, ICUs, ventilators flatten and people quicker getting out. So which is all good news. But again, I want to bring up Rory Fluman from Schenectady County, the manager of Schenectady County, the man I got to know, even though I do like your chairman over there and everyone in Schenectady County, but it's been great working with you pretty much for the last 9 months. I feel like
it's been a sudden brotherhood of stepbrothers.
Yeah, Schenectady and Rensselaer County of all of us talking together and working together, and I want to say it's been great to get to know you, but I couldn't.
Thank you, sir. Thank you for inviting me today, too.
Thank you.
So, we're here obviously because we all have the shared experience of running a county and working, against coronavirus. President-elect Biden, our governor, has called this, war against COVID-19. Our tools are simple, mask use, social gathering compliance, and listening to our public health officials, listening to the governor's office for their initiatives for decreasing the spread. Early on out of the governor's office, it was all about test, trace, and isolate. Those are still primary core functions that we all are doing on this table. Running vigorous testing programs in disparate areas to all citizens with our county. We have to continue with our testing. If you have symptoms, if you feel not right, if you're being called by a contact tracer, you need to do the right thing. You need to reach out to your health professional. You need to call your local office of public health. You need to get to a testing site so that you can be diagnosed or not with COVID-19. Because remember, it's all about the spread. We're in this spot now where it's, as Fauci is calling it, a surge upon a surge. We had Thanksgiving just last week, and so the numbers rising, and we're seeing them starting to explode, frankly. And with that explosion is just community spread. And so with that, we have to continue to comply and have to continue to follow the good advice coming out of the governor's office in public health, which is reducing our gatherings, wearing our masks, just doing the right thing, doing the smart thing, so that we can make it through the winter, so that we can make it to the vaccines. Because if we can do that, we're going to get out of this. And all the other details about funding and federal bailout and federal rescue are very important, so that we can sustain and monetize all these programs of testing and tracing. But we're going to get there. The help is coming, and it's just a matter to get through these next few months. As McLaughlin was saying about getting ready for the vaccine, because if we can make it to those points and we can run our vaccines programs, hopefully this summer, this fall, we're going to be out of this. So again, Dan, thanks for having me come, and I think it's important that we're here in unity, counties in the capital region to spread this message, to spread this word. We're working hard. We want to beat this. We can beat this, and we're going to beat it together.
Thank you, Rory. And it's one of the things that we've talked about and why we came here together, because, and I want to thank Steve too for the phone call, was about getting a joint message out together that, look, we're in this together. It doesn't matter, and I said this yesterday, it doesn't matter what party affiliation you are, what you believe in, where you worship. We're in this together, and we're one in the Capital District, and we can get through it together. And we also want to send the message out there. We know the vaccine's coming. It's probably not going to hit our area from what we're hearing out of the control room, and these two can jump in at any time. It's probably not to January. And there's 5 phases. So it's going to take time. So the people that think that the vaccine, which is great, it's coming out, the governor's team and the governor's going to get it out to everyone, it's going to take till at least the fall of next year before anyone, we're fully get the vaccine and everyone has the shots that they need. So we want to remind people, please just wear your mask, cough in your arm, clean your hands, stay 6 feet apart, continue to do the right thing. These are going to be a tough 2 months ahead of us, and especially with the Christmas holiday, I think, 15 days away?
Yeah, it's coming up.
Something like that.
Yeah.
So with that around the corner and New Year's, we're saying this in a partnership between Albany County, Schenectady County, and Rensselaer County. Please help us do our job, protecting you first and foremost, and help us get through this crisis. And we can unite it. And that's why I keep saying this. I always tell everyone the great relationship that I have with Steve, and the way we joke around. You can joke around about the president's race and everything else and go back and forth, but I go, look, we're working together to get through this. I don't care what affiliation is. It's about helping our people. And the same thing with everyone in Schenectady County. We're working with Rory and his team, and them is really, again, no one sits there in the room and says, oh, I can't help you. Through this whole time, and there's a lot of things people in our counties didn't see. Us sharing PPE, us helping each other out, us helping us with equipment and with different variety of things, and I could go on and on and on, and I'm not trying to pat our back, but we did our job. If Schenectady was falling short, we helped them. If we were falling short in Albany County, Rensselaer helped us, Schenectady helped us. That's what we did for each other, and we thought, what better way to, before the holiday, and I know it's going to be a tough time we're going through the next couple of weeks, is to sit here in unity and put a message out there to everyone. Look, we can get through this. It's a marathon, not a sprint, and we're in this together.
Mm-hmm.
All the testing that we got set up, so please, I'm not going to go through it. You can go to our website. The Times Union Center, though we have it on Monday and Friday, we got construction going on, so pay attention. You got to go in level 3 if you want to park there, so pay a little attention to that. You know what numbers to call. We put it out there all the time. And if you take anything away from this press conference, is us working together. And that's what I do love about the state of New York, but the upstate of New York the most is the partnerships I have with Steve and Rory and everyone going forward, because trust me, it's about the people first and foremost, and we'll get through this. It's going to be tough, people, and when Rory and Steve and I talked about it, we know where the numbers are going. We know where the hospitalizations are going. So, and I know it's hard decisions we have to make. It's harder decisions the governor and his team have to make. So work with us. Try to understand, and if you, again, be part of the solution, not part of the problem. And if you have a better way of doing something, by all means, we all got emails, respectfully, in all of our counties. We get the phone calls. We get people yelling or complaining. Give me an answer to the problem. help us help you, and we can do it by working together regardless. Again, I will say this isn't about party affiliation. This is about doing our job and protecting the people. I want to say thank you. I don't know if Rory or Steve want to end with anything.
I just want to add one thing, and I'm sure Rory and Dan, we're all dealing with this exact same thing. This time of year is always difficult for people. It can be, as much as a joyous time of year, it's a very tough time of year for a lot of folks who get lonely and depressed, and I don't want to miss the opportunity to say, if anybody's suffering any depression, mental health issues across the nation, across the world, you're seeing increases in suicides and drug overdoses. We're seeing that in Rensselaer County for sure. I'm sure Rory and Dan are experiencing the same thing. So just want to add that in, that if anybody out there needs help, reach out to any of our mental health folks and we can get you some help that you need. It can be a very difficult time of year. We don't, as much as everybody's focused on COVID, we have to focus on all of the other things as well that we're dealing with. And those are big issues right now, drug overdoses and suicides. So just, if you need help, reach out to any of our folks and we can get you the help that you need.
Thank you, Steve.
Yeah, we're local government, so there's a platform of services: mental health, social services, police, fire. We are here for you. So if you need help with your COVID fatigue, you should be calling your local county office for help.
Yes, and also I do want to point out that stimulus package does look like it's going to be going through the $960 billion, I believe, so roughly take with they're working out with the Senate and House, which means huge relief to us that we're going to need because we could sit here and cry about our SNAP going through, or HEAP going through, more people on assistance than ever before, people needing housing, people needing to put food on the table, and that's what we do. County governments do so much that people don't even realize what we do day in, day out. And Steve, you said it right. I mean, this is just one little hash mark that we do every day of dealing with crisis in the county. So please, I want to say to Senator Schumer, thank you for what you're doing in your leadership, and Congressman Tonko, thank you, and to Gillibrand. We need to get that package through. We need to take care of local governments, and it's going to help people that need this. That unemployment's run out, so especially with the holiday. Again, thank you. Stay safe.